It's a great question. Yeah, dry eye is rampant at the moment, especially in Perth, Western Australia's
Mm.
environment is not the friendliness or dryness. It's a good question. So look, to answer it simply, in some cases it is a matter of producing too few tears. That's the reality for some patients, but it is a lot more complex than that. So most cases of dry eye aren't caused by too few tears, but they're actually caused by the tears evaporating too quickly. So basically, we have our tear film, and one of the major components of our tear film is actually oil. And this oil is sort of secreted by these glands called Meibomian glands, which run vertically on our upper and lower lids. And they produce this oil. And again, it slows down the evaporation. But what happens in most cases of dry eye is these oil glands are actually blocked. And because these oil glands are blocked, the patient's not getting this oil into their tear film. So they might be producing enough tears, but the bottom line is the tears are just evaporating too quickly. So I guess the sort of take home point is that often rather than being about tear quantity, a lot of the case dry eye is about tear quality. Most cases I see in clinic are caused by issues with the oil glands rather than the quantity of tears produced. But it's quite a nuanced field, to be honest. I think the best thing to do if you have dryness is go and see an optometrist, and then they can figure out what's actually causing the dryness because there's so many different potential causes. There's a lot of subtleties to it. I think it's better to get it checked behind the microscope.
I always think in terms of analogies because it helps me understand things. And the way I think of the oils that you mentioned, it's like the surface cover on a swimming pool. You know, if you've got the surface cover on, stops the water from evaporating. That oil, that layer, it kind of helps prevent the moisture from evaporating from the surface of your eye, doesn't it? And if your oils or if there's something dysfunctional about the way that your eyelids are producing oils, then you don't have that protective cover happening. Is that kind of right close to the mark,
Yeah,
do you think?
spot on. I'll have to steal that one from you, Paul. That's really good.
It's trademarked.
Yeah, you could. I'll give you that one.
So, what kind of therapies do you have in the practice there that might help somebody with dry eye dysfunction?
Yeah, of course. So we see quite a lot of dry eye. We have a sort of dry eye clinic out of my room at Ezekiel Eyes, which we're quite fortunate to have. As far as the treatments that we offer, truth be told, there's so many different things we can do. So the first thing we can do treatment wise is just a conversation with the patient. So we have a chat to them about the timing of symptoms, whether the symptoms get worse when they're using the screens, what type of environments are they in, are they wearing contact lenses, are they taking any medications.
Mm.
Basically, we use all that information to identify whether there's any environmental triggers. And then if there is any environmental triggers, obviously within reason, we try and improve things there just with lifestyle adaptation. So the first treatment we offer, as simple as it sounds, is just a conversation. Now, if we try that and it's still just not working, there's so many different things we can escalate to. So we offer things such as eye drops. Eye drops come in so many different types. It can be overwhelming for patients. So the first thing we do is try and identify what type of dryness it is. So whether it's tear quantity or if it's tear quality, and then we basically recommend an eye drop depending on how the front of the eye is looking. There's other special eye drops such as steroid eye drops to try and reduce some of the inflammation that dryness can sometimes cause. There's warm compresses. So we have a mask called a blephasteam, which basically gently heats up the front of the eye to try and melt some of that oil. And then behind the microscope, we manually use small little forceps to try and force some of that oil out gently in the patient's glands and get them working again. We sometimes give patients homework and we get them to buy heating masks and then
Mm.
do that expression with a gentle massage themselves at home. The other thing we have, which we're really, really lucky to have at Ezekiel Eyes in particular, is we have something called an IPL machine, or more technically, the one we have is an intense regulated pulsed light therapy machine, which is quite a mouthful. But that tends to be a very, very effective treatment for patients that have these dysfunction in oil glands. And basically, what that involves is applying concentrated light to the eyelids. And then that tends to really, really help get these oil glands working and producing again. And then we often follow it up, like I was saying, with this blephastein mask, and then we do this gentle expression as well. So just about anything you can think of, we probably have it there in terms of dryness. There's so many different options. It's similar to the contact lens conversation in that every patient is so individual. Their triggers are so individual. We have something for everyone, I think, is the key message there.
So it sounds like there's a combination of answers here. So there's in clinic therapies that you offer. There are products that people can take home and use, and perhaps there's also education about lifestyle adjustments that are going to help as well.
Exactly. It's a really multifactorial condition. So I think you have to approach it with that in mind. But I mean, the important thing is no matter what treatment we give, again, it's important to come in and get an assessment so that you can match the treatment to the cause rather than just throwing everything at it. I think you need to be a little bit more precise. And that's sort of the approach that I try to take, is get an understanding of what's actually causing the dryness before we try and blindly treat it.